This week on Healthy Living, we shed some light on the highly infectious bird flu virus. And Nigerian Veterinary Expert Dr. Lauratu Lawal Halilu discusses the impact of avian influenza and shares some prevention steps. Finally, Zambia struggles with droughts and floods. These stories and more in this edition of Healthy Living. Hello, I'm Linor Moudou. Thank you for joining us for another edition of Healthy Living. A severe variant of the H5N1 bird flu virus has been spreading around the world since 2020, leading to outbreaks in commercial poultry and causing sporadic infections in other species. This highly infectious strain of avian flu is most often contracted by contact with infected animals and can also be passed from person to person. Some African countries, including Gabon, Mozambique, and Burkina Faso, have reported bird flu outbreaks in recent years. In the U.S., the state of Colorado has reported at least 4 confirmed cases of H5N1 virus in poultry workers, according to the CDC. Meanwhile, in Mexico, a man died from the virus this year in April, marking the first fatality worldwide by the disease in 2024, according to the World Health Organization.
The World Health Organization announced Wednesday that the first laboratory-confirmed human case of infection with H5N2 avian influenza virus had been reported from Mexico. The man was taken to hospital in Mexico City and died later that day.
The patient died after 3 weeks of complications in January. He was bedridden for 3 weeks, then went to the hospital because of complications, respiratory complications, and died in the hospital on that day, which was, I think, 24 April.
His body was subsequently routinely tested for flu and other viruses, and H5N2 was detected. The 17 contacts of the case in the hospital were identified, all tested negative for influenza. In the man's place of residence, 12 contacts in the weeks beforehand were identified. They all tested negative also.
Investigation is ongoing, serology is ongoing. That means the blood testing of contacts also to see if there was any possible earlier infection. At this point in time, we do not know as it's multifactorial, it's a multifactorial death. That's how it is going down into the into the files, so to say, in such a case.
The WHO said that the source of exposure to the virus was unknown, though H5N2 viruses have been reported in poultry in Mexico. A different variant of bird flu, H5N1, has been spreading for weeks among dairy cow herds in the United States, with a small number of cases reported among humans. However, authorities say none of them are human-to-human infections, with the disease jumping instead from cattle to people.
Dr. Lauratu Lawal Halilu is a veterinary doctor with the Ministry of Livestock and Animal Health in Zamfara, Nigeria. She tells us more about bird flu.
Bird flu can also be called avian influenza, and is an infection of poultry, which is caused by avian influenza virus type A. Then this infection is normally carried by migratory birds, who serve as the natural reservoir for this infection. Bird flu can be divided into 2 based on its pathogenicity. We have the low pathogenic strain of avian influenza, and we have the highly pathogenic avian influenza virus. And this highly pathogenic avian influenza virus is the zoonotic type, which means it can be transferred to humans. Recently, yes, that is January 2023, there have been reported cases of over 299 outbreaks in farms among the 28 states of Federal Capital Territory. So we can say Nigeria is at risk of avian influenza infection. And why Nigeria is at risk could be because of this, Nigeria being a migratory route for migratory birds, because it's part of one of the flyways for migratory birds. Infection normally occurs maybe through plucking, through cutting, or through processing of meat. Then improper processing of meat at home for consumption can also lead to transfer of this infection by eating improperly cooked, or not even from eating, maybe contact with their blood, their fecal material in the surrounding, or not properly disposed wastage of these poultry birds. Well, the symptoms of humans varies. We have, there could be fever, there could be cough, we could have sneezing, we could have mild respiratory infections, then there could be fatigue, muscle pain, we could experience vomiting and diarrhea. Sometimes it could also lead to multi-organ failure and even death in humans. For the treatment, it can be treated using antiviral drugs. The precautions could be one, practicing proper hand hygiene. That is by thoroughly washing your hands frequently with soap and water. Avoid contact with all the infected poultry birds. We could also have awareness of public about this bird flu infection and the risks it poses to them. Then we can also use, we can also properly cook poultry products or poultry before consumption. Then proper disposal of dead carcasses is also important. There have been measures, especially by the One Health policy on avian influenza. They had measures such as quarantine measures, then proper disposal of infected or suspected birds, the population also of infected birds, then frequent disinfection of farm premises, contact traceback is also done, then compensation of these farmers whose birds have been disposed.
What do you know about the avian influenza, and how do you ensure that the poultry and meat you eat are safe for consumption? Here are some reactions from Kigali, Rwanda.
Yes, it's a virus that is spreading. It's something that might concern me. I might be concerned that it might get in my country, but I'm positive that my government has some measures put in place in case that it breaks out in Rwanda.
If this disease, which is a viral disease that can be spread easily, is reported in one country on the African continent, it might end up affecting poultry farms in another country on the continent. So I don't have what I can say like a reliable measurement tool to ensure the safety of meat I eat. So what I like, the safety of the meat I consume would be in the hands of the meat regulators, for instance, or the consumer protection bodies in the country.
We know that these viruses can cause some people to death, so that's why I am concerned on it, because if affected, or because if I'm affected to these viruses, it may cause some challenges and the consequences to my life.
It is a concern for us because we usually consume meat, especially those ones from hen and the flying things that we used to consume. But sometimes we don't see a paper that shows that kind of meat are safe. We don't see what is justifying the quality of the food that we consume. From the day I heard about that kind of flu, I started thinking that consuming those kind of meat can be an issue. That's why I confirm that it is a concern for me.
Did you know that Salmonella is one of 4 key causes of diarrheal diseases in the world? Every year, almost 1 in 10 people fall ill because of foodborne disease, according to the World Health Organization. Diarrheal disease stems from a series of infections from unsafe food. It affects 550 million people annually, including 220 million children under the age of 5. It is also the 3rd leading cause of death in children aged from 1 month old to 59 months old. Salmonella bacteria cause a foodborne illness called salmonellosis. Symptoms include diarrhea, fever, and abdominal cramps. It is often linked to contaminated poultry, eggs, beef, and sometimes fruit and vegetables. Most cases of Salmonella are treatable. Severe cases may require antibiotics. Young children, the elderly, and those with weakened immune systems are at higher risk of serious complications. Always handle food safely to reduce the risk of Salmonella infection. Cooking food to the appropriate temperature and practicing good hygiene can prevent infection. Zambia is at the forefront of severe climate change with frequent droughts, floods, and heat waves. Around 9.8 million people in 84 of Zambia's 166 districts are affected by global warming, with 6.6 million people in the country needing immediate humanitarian assistance. Among the most vulnerable of the population are those who have contributed the least to the crisis, such as women and girls. Here is more.
In the drought-affected provinces of southern and western Lusaka, acute malnutrition is high among pregnant and breastfeeding women and is expected to worsen as the lean season begins next month. When food is scarce, women often eat last and least, sacrificing their own needs to feed their children.
Women may not prioritize going to the health facility in terms of a crisis of a drought like this, but instead would prioritize looking for food. So this has the possibility of impacting their health. So UNFPA is supporting Ministry of Health to conduct the mobile clinics, the health outreach activities, so that they can provide these services to women and girls, especially in this situation.
This situation poses an incredible risk to the health of mothers and their children in a country that already has one of the highest rates of malnutrition in sub-Saharan Africa.
Today we are providing ART, we are providing antenatal services, we are also providing children's clinic services, also family planning, and slight of part of a bit of OPD.
In drought-affected provinces, UNFPA is working with communities and first responders to support reproductive health and gender-based violence prevention and response services. Services include medical treatment for people living with HIV and identifying and treating pregnant women who are malnourished.
They don't have food. As a result, teenagers, they end up they become vulnerable. So they engage themselves in sexual activities. So when we talk about HIV, even HIV rate, it's quite high in adolescents because they engage themselves to these fishermen because they want help, they are vulnerable.
Some of these communities live hours from the nearest health facility. In Hakunkula village, the nearest clinic is at least 30 kilometers away. Taking services to communities is critical amid concerns that women and girls are prioritizing the search for food and water instead of their health.
Monze has about 43 health facilities. So in all those health facilities, currently UNFPA is providing support for mobile clinics such as this to be undertaken at least once every month for the coming 3 months. So this is where the situation comes in, where we need more support, we need more resources to be able to ensure that there's continuity of these mobile clinics across the next coming months. So we really need to ensure that we provide this necessary support. And as you can see from the outcome of the event here, there's really a need for these services.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linoch Mudu. Until next time, stay well and strive to make every day a healthy day.